On Thursday, House Republicans passed their version of a born-alive abortion bill, following the previous day's blockage of the Senate version by Democrats. The bill mandates that healthcare practitioners provide the same level of professional skill, care, and diligence to a child born alive during an attempted abortion as they would in a typical childbirth scenario. Republicans have positioned the bill as a measure against infanticide rather than an anti-abortion initiative. In contrast, Democrats criticize the bill as redundant, arguing that killing infants born alive after an attempted termination is already illegal, and the legislation merely serves to criminalize doctors. Healthcare providers who fail to comply with the law could face fines and up to 5 years in prison or both. The Born Alive Abortion Survivors Protection Act previously passed in the House in 2023 with a vote of 220 to 210-1. At that time, Texas Democratic Representative Henry Cuellar joined Republicans in supporting the bill, while Representative Vicente Gonzalez from Texas voted present. The bill also passed in 2015. On Thursday, it passed in the House with a vote of 217 to 204, with one Democrat supporting the bill and another voting present. This passage occurred just one day before the anti-abortion March for Life in Washington on Friday. On Wednesday, Senate Republicans attempted to invoke cloture on their version of the bill, but without the necessary 60 votes, the motion failed. Republicans interpreted this failure as Democrats voting against a measure to combat infanticide. Senate Democratic Whip Richard Durbin from Illinois stated after the motion's failure that the bill would have established a new standard of care for physicians providing reproductive health care that is not based on medicine, fact, or science. He emphasized that it is already law that any child born in America, regardless of the circumstances surrounding that birth, is afforded equal protections. Before the bill's passage in the House, newly sworn-in Democratic Representative Kelly Morrison from Minnesota, an obstetrician gynecologist, criticized the bill as cruel to patients. She highlighted that medical complications can sometimes prevent a patient's dream of building her family from coming true. She described the devastating moment when a patient and her family learn about a lethal fetal medical condition incompatible with life. Morrison emphasized that doctors are already honored and obligated to provide appropriate care for their patients. Republican Representative Michelle Fischbach from Minnesota argued that the legislation is not about abortion, but about medical care for babies. Representative Chris Smith from New Jersey passionately stated on the floor that these children should not be treated as garbage and stressed the need to protect them once they are born after an abortion attempt. He described the legislation as humane, pro-child, and pro-human rights. Data from the Centers for Disease Control and Prevention indicates that between 2003 and 2014, there were 143 deaths involving induced terminations where infants were born alive. In their objections to the bill, several House Democrats shared personal experiences of losing wanted pregnancies and choosing termination to preserve their health or that of their family members. New York Representative Timothy M. Kennedy shared how he and his wife faced a non-viable pregnancy that threatened her life. He expressed concern that if this bill had been law, doctors would have been required to separate them from their daughter inhumanely, causing unnecessary pain and suffering.